Welcome to How to Pass the RN NCLEX by Stephen King. Yes, that's me, and I passed the RN NCLEX on the first time in 75 questions. In this video, I will show you some of the resources that I used, give you some tips for test taking success, and I'm going to give you some suggestions on what to do the day before the NCLEX as well as what to do on the day of the NCLEX. There's no end to the resources that are available. How do you pick the right one? I certainly will recommend to you the CLIMAC reviews. You will hear a lot about this in various forums and even on YouTube. I attended the CLIMAC reviews in person, and while it is a little expensive at $395, it will help your nursing practice as well as help you think about specific items critically, particularly about prioritization and acid-base balance. On the left is the famous yellow book. If you've ever seen that PDF floating around, that is what it looks like. The review course is 3 days. I took the review course 6 months before I graduated from nursing school. Mosby's Pharmacology Memory Note Cards is a must-have resource. This small spiral-bound booklet is compact. It is separated by body system. It is colorful, it has multiple pictograph-style memory aids, and it highlights need-to-know information. If you'll look at the graphic on the right, especially the top portion, notice that it really amplifies nursing implications. The NCLEX tests you on safety. This booklet will help you master pharmacology. Another must-have resource is Michael Reed's NCLEX RN Cram Plan here by Cliff Notes. When I searched Amazon, I noticed it was available for $22. This book is written in an extremely easy to digest format, and I read this book cover to cover 2 times while I was preparing for the NCLEX. Certainly, there are a lot of YouTube videos that you can watch as you prepare for the NCLEX. One of the best I'll commend to you is Level Up RN, hosted by Kathy Parks. Her videos are very short and she's very knowledgeable. One of the negatives might be that she's just looking at the camera talking to you and she's always trying to sell you her flashcards. But in my estimation, her videos are the best for review. In preparing for the NCLEX, I watched all 114 of her med-surg videos and I watched all 50 of her pharmacology videos. You can't go wrong listening to her when you review for your exams and especially when you prepare for the NCLEX. Perhaps one of the best YouTube content creators for nursing is Registered Nurse RN. Sarah does this as a labor of love, and some of what I like is that she's very knowledgeable, but if you're a visual learner, the concepts that she's speaking about are illustrated on a whiteboard, as you can see in the graphic depicted on this slide. Another great thing is that she includes exams and notes that can be downloaded for free, and these exams are written in the style of NCLEX questions. The only negative is that the videos in her med-surg section can be very long, 20 to 25 minutes, but clearly this is the best resource for learning available on YouTube. A pro tip that I would definitely offer you is that if you're going to watch YouTube videos, change the playback speed. Notice the bottom arrow. If you select that gear icon, a little menu will populate and you can change the playback speed. I always change the playback speed to like 1.5. What does that mean? If a video is normally 6 minutes long, now the video will play in 4 minutes. It just gives you additional time to cover more of these videos. Notice also that you can turn subtitles on for videos, so if you're a visual learner, you might find that helpful so that you can see drug names as you're studying for pharmacology. Some students are much more auditory driven. I like to listen to things and to learn. You might benefit from a subscription to Audible, where you can download audiobooks. One such audiobook that I used to study for the NCLEX was Nursing Audio NCLEX RN Review. Med Talk, learn while you live. So what does that mean? If you find you have a little bit of time, you're cleaning up around the house, you're trying to get in some cardio, you can be reviewing nursing concepts. Notice on the right-hand side that the book is broken down by system. and you see the time commitment that you have. So another tip would be change the playback speed. I would change the playback speed to 1.5, cover it a little faster. So if it were a 55-minute audio presentation, now I've shortened it up to 36 minutes. It just gives you more time to cover it faster. I listened to this particular audiobook 2 times in a 6-week period to help prepare for the NCLEX. An old standby will always be written NCLEX examination preparatory guides, and there are plenty on the market. The one that I used when I became an LPN was the Saunders Comprehensive Review for the NCLEX PN test. I bought it, and I think it's one of the better books that you can read if you like these types of books. The key, though, is to read them, to study them, to read, and then do the questions that are listed. I think the redeeming factor of Saunders is that it always gives you a great anatomy and physiology review at the beginning of each body system. So you've got that fresh in your mind while you're contemplating questions. And that brings up a key point. Remember that repetition is the key to adult learning. So you can see on the left-hand side of this slide that as I would listen to various videos or I would be reading things, I was taking notes. And sometimes that can get laborious. I filled an entire spiral-bound notebook with these kinds of notes, and then I thought I would never ever go back and look at it. So I decided to use a free resource called Evernote to help me keep my notes organized, but more importantly, to give me an opportunity to look at those notes anywhere I was to do review. And while it's technically not part of an NCLEX study plan, you could do worse than Evernote. Evernote is a free online ability to organize notes. What's really cool about it is that you can download the application on multiple platforms, such as your iPhone or your Android phone, your iPad, your desktop computer. And when you make these notes, it syncs across all platforms. So if you're sitting at the doctor's office and you have 15 minutes while you're waiting for your appointment, you can locate a note that you've created and you can do some study. This was indispensable to me as I was preparing for the NCLEX. And just to give you a bit more about how that looks, this is an actual screenshot from Evernote on my desktop computer. So you can see on the left-hand side, you have what's called notebooks. So you can have notebooks for anything, and I've actually blurred out some of the personal notebooks that I have, but I'm showing you the relevant ones that I use for study, like when I used Archer and when I was studying for the NCLEX. So inside each of those notebooks, if you move to the top, you can see there are various notes. So in this example, I've show you that I was studying lab values and fluid and electrolytes. And I selected the one that I did that's called System by System Neurology. So you can see what you can do in these notes. You can type in these notes, you can bullet these notes, you can add graphics, you can add sound, you can add attachments. It's wonderful. And then you sync it across all platforms and you have something available that you can study right at your fingertips. Indispensable aid, can't commend it to you enough. If you're a Microsoft subscriber, you already have OneNote, which is similar, but I like Evernote better. And as I mentioned, it's free. Without a doubt, the best way to prepare for the NCLEX is to do NCLEX style questions. And there are several question banks that exist in the market, such as Archer Review and UWorld. I chose Archer Review because frankly, it's cheaper than UWorld. And as you can see, there are a lot of different things that you can get when you use a question bank. With Archer, they have on-demand videos that you can also subscribe to for your subscription period. And I chose to do the rapid review combo with on-demand videos and the quiz bank. And you can see that when you go into it, it shares with you how many questions you've used, how many you've got right, how many you've got wrong, because you're going to get some of these questions wrong. There's just no way around it. You're going to get them wrong, but it's what you do with the wrong answers that makes or breaks you on the NCLEX. To illustrate what the on-demand videos look like, you can see that the videos go over various systems. One of the things I did is I spent the 19 hours that you see for the rapid review day 1 crash course, day 2 crash course, because it gave need-to-know information through all the various body systems. And Once again, change the playback speed. So I changed it to 1.5 and in some instances twice the speed of the speaker, especially if I knew the concept and I was just wanting to review. But the key is I had Evernote up and I was making notes. I was typing notes as I was listening. And those kinds of things are indispensable for learning. The more that you can repeat something, the better you will be for learning the information. Here is an actual test question from the Archer quiz bank. This one happens to be about obstetrics. And if we key in on the fact that the question says that a person is experiencing painless bright red vaginal bleeding, well, that's a clarion sign of placenta previa. But notice that there are several things that you have here in the quiz bank. You get to see all your choices and then you can strike through those that you've eliminated. Now note, you won't be able to do that on the NCLEX. Below that, you can see automatically, was it correct? How many of your peers answered it correctly? Now here's an important one. How much time did you spend? Most people read questions too quickly. So this will give you a clock time to say, hey, I need to slow down a little bit. Then below it, you have those rationales. Why was choice A correct and the others were incorrect? If you got a question wrong, you would want to spend some time at least reading the rationales. Some people will write them. I don't find that to be helpful. I think that if you read a rationale, you're trying to understand, why did I pick the wrong answer in this question? That's what's going to key you in on the NCLEX. And also, Archer will give you additional information, just a little bit of a review at the bottom of most questions, which can be helpful. But these things are only as good as your willingness to use them. Use the quiz bank questions. Now let's just talk about a few tips for test taking success. Now this is geared primarily at the NCLEX, but you can use these kind of strategies on any exam that you take. On the NCLEX especially though, don't overthink the question. You've been given all the information that you need. Now answer the question with what you have. Don't read into the question. Don't start saying, well, but in my situation, I would do this. And I remember when I worked over here, we would do that. Don't read into the question. Don't think, well, if this were the situation, I would do this, and it's not listed. You're thinking it too much. You just need to look at the answers provided to you. To help you slow down, read the question twice. Then see if you can rephrase the question in your own words. Think about, what is this question asking? What body system is being developed? What drug is being amplified? Do I know anything about their side effects? Where does it work in the body? See if you can rephrase the question in your own words. Read the answer selections carefully. What can you eliminate? In most of the multiple choice questions, you'll see that there are two that you can eliminate pretty quickly. And if you're stuck between two choices and you don't know where to go, pick the more global response. What would be more appropriate for all patients? The select all that apply questions are dreaded by everybody. Several strategies exist, but the best I have found is that after you read the question twice, read each possible answer and say, is this statement true or is it false? If it's true, pick it. If it's false, don't. The number one mistake that people make on select all that apply questions is that they pick one more selection than is needed. So don't pick it and go with your gut. And remember, the NCLEX is primarily assessing safety. It all boils down to airway, breathing, and circulation. And at this point, I will give Dr. Zishan from NCLEX High Yield a shout out because his Ask Graph method is worth looking into. And here is a depiction of that Ask Graph method that I snagged from Pinterest. You can see that he has his own layout for prioritization topics, and he would say that airway is always king. Just like in ABCs, it all starts with airway. And the rest of this is not ranked in order of importance. So sepsis doesn't come before kalemia, for example. But this is just acute mnemonic so that you can remember things that are very important. I didn't find this to be very helpful on the NCLEX. Maybe one question actually helped me with Ask Graph, and most of my questions were prioritization. But this is a good system to learn, that you can always think about airway, if the patient's septic, if the patient has changes in kalemia, such as low hypokalemia or hyperkalemia, glucose monitoring, especially if it's less than 70, if the patient suddenly becomes lethargic. This is a big area for children. if the patient has altered mental status, peritonitis, or hemorrhage. Again, it's just Dr. Zishan's way of organizing prioritization. And you can find some good stuff at highyield.com. He even has a 4-week NCLEX course that you can take. It's constantly opening. He has kind of a homeboy DJ kind of appearance, and that's how he talks. And if you like that, you might find that that's something you want to investigate. I found the price point to be way too high for my budget. Now, what do you do the day before the test? Keep focusing on questions. When in doubt, do some more questions. If you're getting things wrong in particular areas, do quick reviews over any areas that you don't feel comfortable. This is where, if you've had notes that you've created in something like Evernote and you're getting PEDS questions wrong, go back and spend 10 or 15 minutes and review those notes that you made about pediatrics. It'll help you. And then go back and do some more questions. Make sure you plan extra time for sleep because you're going to be nervous the night before the exam, and that can keep you awake. So go to bed earlier so you can fall asleep and be rested. Also, make sure you know how to get to the testing center. Most Pearson VUE testing centers require you to be there 30 minutes before your exam time because there's a whole system that they have to put you through and scanning your palm, checking your ID. So make sure you know how to get there because you don't want a new traffic pattern to screw you up and keep you from taking the NCLEX. And now the day of the NCLEX has arrived. What do? Make sure that you eat a healthy breakfast so you got plenty of energy flowing through your body and especially your brain so that you will be at your best. Do not study on the day of the exam. No last-minute cramming is going to help. In fact, it's been shown to be counterproductive. One tip would be to listen to classical music on your way to the exam. There are several studies that suggest listening to classical music helps you with recall. If you've got a 30-minute commute, turn on some classical music and see if it helps you. Make sure that you relax. You know the material. You have graduated from nursing school. You will be the next RN. And I'll give you a few parting words just to say thank you for watching this video. Remember, the most important thing you can do to prepare is to do practice questions. 2 weeks before I took the NCLEX, I was doing at least 300 questions a day in blocks of 75. Do the question. If you get it wrong, read the rationale. If you're getting things wrong consistently in the same genre, go back and review notes in that genre. Spend 3 to 4 hours studying every day that you can. Over a 6-week period, I studied every day on my day off, 3 to 4 hours, and then did questions. The best study method I can recommend to you is to read for 25 minutes on something and then take a 10-minute break. Your mind needs time to synthesize the information. So a pro tip would be set an alarm to remind you to stop at 25 minutes and take a 10-minute break. Set the alarm so that you spend 10 minutes not reading, not doing anything. Get up, walk around, stretch, and then come back renewed, revitalized to go back into the information. Once you have aced this examination, please drop me a line and let me know what your study plan was. Email me and let me know if you used any portion of this plan. And then share this video with someone else, because here is to your NCLEX success.